After weeks of intense debate, the FDA has finally weighed in on those COVID vaccine boosters.
A key panel today ruled that some people who received the Pfizer vaccine should get a third shot, but not everybody. The ruling is for anyone 65 and older and for those with a high risk of serious complications. It rejected the booster for people 16 and older. There's also no timetable on an extra shot for people who received Moderna or Johnson & Johnson. Now, there are currently 868 people being treated in Colorado hospitals. That number has dropped the last 3 days, which is a promising sign. 83% or 720 of those patients are unvaccinated. 148 people are fully vaccinated, but most are in the group that makes them more likely to have serious complications. The idea behind today's ruling is to better protect that part of the population that is immunocompromised. Karen Morfitt has been looking into that decision for us tonight. And Karen, you talked with two of the top infectious disease experts in the state about what this means.
And Karen, they say this is a good thing. They say it doesn't come as a surprise to them because what this means is that the vaccine that more than 70% of Coloradans already have continues to work against even the Delta variant. They say now the focus needs to be put back on those who are unvaccinated. Plans to roll out a Pfizer booster shot to the general public will be scaled back. This after the Food and Drug Administration approved it only for a targeted group.
They felt like there wasn't sufficient data at this time to recommend it broadly to all comers.
Dr. Michelle Barron is the director of infection prevention at UC Health.
They did tentatively approve it for over the age of 65, those that have high-risk medical conditions, as well as healthcare workers.
So why not give the option of a third dose to everyone?
They just didn't feel like they had enough evidence yet to say that the potential risk of a side effect or a complication was worth the added benefit.
Beyond that, Dr. James Nye, the director of infection prevention at the Medical Center of Aurora, says it's because the vaccine works.
The vaccine is holding just fine in everybody below 65 at this point.
He says they're seeing that in their hospital, where the majority of COVID patients are those who have not been vaccinated.
We are seeing vaccinated patients who are sick, who are in the ICU, but it is the people that we've expected from the get-go, people who might not have a robust immune response.
Now, earlier this week, the governor of Colorado had some strong feelings about the FDA making a decision on these booster shots today. In a statement, he kind of disregarded that today. He says he is glad that hurdles have been removed so that they can get those boosters to the people that need them most. And he says that includes seniors in nursing homes. He says they could be ready to get those boosters to those folks as early as next week. For now, we're live. Karen Morfitt covering Colorado First.